This lesson has a bunch of things in it. Let me pull it up. Um, it's hard to know because we've taken a lot of our modules and put them into a specific breach course. We have got a gazillion skills all over the place because we, as Birthing Better families who developed these skills in the early 1970s, nitpicked the crap out of every single one of our birth experiences. So we created skills for everything. They're not always applicable for every situation, so we don't know. We have a massive course called the Complete Course. This is quite a big course as well. You should pick and choose what skills you want to learn as a birthing woman first and learn them. And if you're a birth coach, pick and choose the skills you want to learn first, learn those first, and then teach each other. Makes learning faster and you integrate better. So in this lesson, we're going to talk about the 3 roles. I know that sounds sort of la-di-da, but honestly, people just don't really know. And it's very confusing. I mean, women know women are birthing. That's fine. But honestly, women don't know. This is all this thing about choices and making birth plans. You don't really know who's in charge. The choice-based childbirth trend of the late 1970s, basically, that you're living in now, basically puts you in charge. You're not in charge. The fact is you're a birthing woman and you are going to a care provider. Their skills are different than the skills you need. Your birth coach has different skills they need. And fathers, when I gave birth in 1970, they coached us, they helped us. When I gave birth in 1982, they had been told not to coach us and just to support us and be there. So you need to know what the roles are and you need to get clear about them, and then you need to have the skills for the task at hand. We talk about a progression of labor. If you're going to have a breech birth, you want your labor to be progressive. And you need to know how, and that couples with the body skills and the positions that you're in. You need to read contractions. Your baby's giving you a message in each contraction. If your labor starts, goes up, peaks, goes down, goes away, that's a progressive contraction. If your contraction starts, goes up, plateaus off, goes away, that's a non-progressive contraction. And that is your baby's message telling you that there are factors in your body that are stopping your baby from opening you up and coming down. And those factors we discussed. You have either bent your shape and your baby doesn't like that. You have internal tension in your body that your baby doesn't like and is trying to open up. Or you've compressed your container and is making it harder for the baby. When you get those things sorted out, then the labor becomes progressive. And when it becomes progressive, it becomes more painful. And this is where you need to have skills to cope. Because if you don't like the pain, you will get into positions that back off your labor, that are non-progressive because it hurts less. So this is the insanity. And you need to sort it out in your breech birth. Then we're going to talk about the negative and positive birth. I have been absolutely, totally frustrated by the message of women. Don't listen to negative births, only listen to positive stories. We can't learn from each other if we're only listening for positive stories. And the positive stories are mamby-pamby. I had a great birth. That isn't what you need delivering this baby. You need to know how to do this. And what is a positive birth? Well, a lot of the natural birth movement is saying to us, it's the highlight of our life. We should have this orgasmic birth. Well, I want to tell you, having been at just a gazillion births in 50 years, the vast majority of us do not like it. It hurts. It's uncomfortable. It lasts longer. It's different than we thought. They're doing things to us that we don't particularly like. We have lots of negative thoughts. I gave birth, my last birth, in a strange hospital with a baby that was 8 weeks premature. Was I thinking positive thoughts at that moment? Not particularly, but they came in and did assessments, monitoring procedures. I couldn't get out of bed. Did I particularly like that? No. When I had a contraction that was really intense, you think I liked that? No. My mind goes F, 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 F. But I have skills. And you can listen to my birth experience. I disciplined myself to use skills. So this resource is how you do that. Then we talk about the 5 phases of contractions. I talked about it just a few minutes ago. The contraction starts, goes up, peaks go up, comes down, goes away. Those are 5 phases, which means we can now use our skills in any of those phases. rather than what we were stuck with for eons, which is the contractions aren't too painful now. Oh, now they're getting more painful. Now the contractions are painful. Now I'm feeling like I'm having trouble coping. Now I'm not coping. So we used to take a contraction as though it's an entity. Now we know it has 5 phases. And of course, now we have to talk about pain. So we talk about pain in this as well. Pain occurs naturally. It occurs, and we have to deal with it. Yes, labor pain is distinctly different from other pains. It's considered to be productive. But when you're in it, you don't feel it's productive, you just feel it hurts. So we need to be able to use our skills to cope with the natural occurring pain. And we have the skills, you're learning the skills, and we want to encourage you to just keep knowing that a lot of us just dug deeper the more painful it got. Did some of us use pain relief? Sure, of course we did. But with the Birthing Better skills, a lot less of us did because we really dug deep. We understood the negative voice. We coped better. We used the 5 phases of contractions. We understood that when we had a progressive birth, that was good. And we just kept going. And we just kept going. And we had prepared our bodies so our births were shorter. Our second stages were shorter. They still did lots of things. Many of us as Birthing Better families were wired for sound. We had tubes coming out of every single hole in our body, and we birthed beautifully, and nobody can take that away. So this lesson is full of stuff. It's called sort of the soft skills of Birthing Better.